start doing the tibial tunnel by placing the tibial jig just adjacent to the anterior horn of the lateral meniscus, so that our beath pin must enter the joint just adjacent to the anterior horn of the lateral meniscus. Once the beath pin is inside, then drill the tibia with the reamer that corresponds to the diameter of the graft we obtained. After doing the tibial tunnel, we have to do the femoral tunnel. While doing the femoral tunnel, it is always necessary to flex the knee joint more than 110 degrees and shift the scope to the anteromedial portal and make the tunnel through the accessory anteromedial portal. While drilling the femoral tunnel, we keep the femoral offset at least 6 mm or 7 mm offset, which makes the beath pin entry 7 mm off the posterior cortex of the femoral condyle. Once the beath pin is inserted, then drill the femoral tunnel using 4.5 mm drill bit. Once the tunnel is made with the 4.5 mm drill bit, we have to check the length of the tunnel using the depth gauge. Then reinsert the beath pin and make the tunnel with the reamer that corresponds to the diameter of the graft we obtained. While doing the drilling, make sure that you drill the tunnel at least to the 20 mm with the reamer that corresponds to the diameter of the graft. For example, if the graft diameter is 8 mm, you take the 8 mm reamer and ream the femoral tunnel up to 20 mm or 25 mm depending upon the length of the graft using the 8 mm reamer. So this diagram shows how much to drill. If we are using the fixed loop, we must drill 8 mm more than the desired length of the graft inside the tunnel. Suppose if the length of the tunnel, total length of the femoral tunnel is 40 mm, and if we want to keep the graft till 25 mm, we must add 7 mm to it and drill up to 32 mm using the 8 mm reamer. This additional 7 mm is for the flipping of the endo button on the cortex. If we are using the adjustable loop, where the loop length is not fixed and we can adjust it after flipping of the button, this extra 7 mm need not be drilled. So once the femoral tunnel is drilled, we feed the beath pin with the ethibond loop and pass the ethibond loop from the anteromedial portal through the femoral tunnel to the outside of the thigh on the lateral aspect. And then we use the suture retriever through the tibial tunnel and pull the ethibond loop through the tibial tunnel outside. Using this loop, we pass the graft through the tibial tunnel into the femoral tunnel and then flip the button on the outer cortex of the femoral condyle. After fixation of the femoral side, then fixation of the tibial side is done by using the interference screw. We can use titanium screw or bio screw. Again, in the bio screws, we can use bioabsorbable screw or biocomposite screw. While fixing the screw in the tibial tunnel, we should keep the knee in 15 to 20 degrees of the flexion and then fix the graft in the tibial tunnel using the interference screw. This is the final graft position after fixation of the both femur and tibia. This way we can do the complete ACL reconstruction using the arthroscopic technique. Thank you.